Bipolar disorder is not mood swings, going from calm to angry or happy to irritable or 0 to 100 really quickly. People say they've been diagnosed with bipolar, but these type of mood swings can be triggered from varieties of things. Can be triggered from PTSD or trauma history, and often get misdiagnosed as bipolar disorder. The reason that's important is because the treatment is going to be different. Bipolar really needs medications and therapy, whereas trauma can probably be more sorted out through therapy. Other misconceptions about bipolar: people say they go on phases where they spend a lot of money, and that's how they're diagnosed with bipolar. That is usually not enough to be diagnosed with bipolar. That may simply be poor self-control or a psychological defense that is just unhealthy. In order to accurately diagnose bipolar disorder, it's important for one to be sober from alcohol, cannabis, and illegal drugs. Even certain medications such as steroids or stimulants can mimic bipolar disorder. Bipolar disorder is a collection of multiple symptoms, at least 4, sometimes up to 7, in which people go several days, not just 1 or 2, but several days, maybe 4 days, a week, longer, of an elevated or irritable moods, talking very fast, having a lot of ideas, having an excessive amount of energy, not needing sleep. Maybe they're doing several activities that feeling that they're just not tired and they have these special powers or abilities that other people don't have. So it's really this collection of symptoms, and to precisely know which ones, it's something that you got to get diagnosed by a psychologist or a doctor. But as you can see, those collection of symptoms are much different than just having mood swings. Bipolar disorder also has a major genetic component to it. It can run in families. Oftentimes it doesn't happen in isolation, but people have a family history of a depression or a bipolar disorder. Many people with this condition also self-medicate with alcohol or drugs, and the anger that they can get super angry, where they break items around the house or get violent towards other people. People with bipolar may also deprive themselves of sleep, and they can get psychotic. Often in these cases, it's considered to be a psychiatric emergency, and they need to be treated in a psychiatric hospital setting. It's important to know what bipolar and really any mental health condition is or isn't, because the medications and how to treat it will differ. Oftentimes, the condition is overly diagnosed in hospital settings because insurances are more likely to pay the hospital for someone who needs treatment for bipolar disorder than other conditions or situations that may actually bring them to the hospital. And just to note, there are different severities of bipolar disorder. Some people get really high and elated. Most often they cycle between high and low, and tend to more commonly get depressed or low moods. But again, the nature of these episodes need to be investigated by a trained clinician. They cannot be a result of drugs, and treatments can vary quite a bit based on the people, the severity, and the circumstances.